Hello friends, let's see what are the post-operative care for cataract surgery. I hope you had a good cataract surgery done. Now let's see what are the normal symptoms you can have post-operative after the surgery has been done. Some patient might complain of some pink or foggy vision. Generally for the first 24 to 48 hours the vision is slightly blurred because the pupil is dilated, and because of that the vision is not very focused. So just relax, your vision is going to get better over a period of time. Most of the patients have fairly good vision in the first week to second week, and the later vision improvement happens over the next 1 or 2 weeks. So then don't get worked up, the vision improves over a period of time. The normal symptoms which you can have after the cataract surgery is slight scratchiness in the eye. You might feel like some sand has gone in your eye. That's quite okay. There might be some red spots in your eyes, which is also okay. This is because of the subconjunctival hemorrhage. Third important symptoms many a patient feel is there is a slight shimmering of light on the sides, which is also normal. Sometimes patient might feel that there is a curtain like thing on the side of his eye, which is also okay and which improves over a period of time. The point which needs to be very concerning are a sudden drop in vision, excruciating pain which is not treatable, or sudden redness and watering and vomiting. If at all these symptoms, you have to consult your ophthalmologist immediately. Rest of the symptoms are part of the normal recovery process of the eye. So it will take some time for the eye to heal. The normal recovery process is in the range of a week or 2. By the time the glasses would be given for you and you can have a fairly good vision. Now what are the do's and don'ts? Do's: you can do most of your regular errands. You need not restrict yourself to a dark place. You can move around, but remember, whenever you have to go out, especially for the first week, wear some dark glasses, because your eyes become a light sensitive, and that's why it is always advisable that you wear some kind of protection when you go out. In your natural eye home environment, it's not really required for you to wear those glaze. Second important thing is avoid rubbing of eyes. That's the most important thing, because the wounds, although they are self-healing wounds, they are small wounds, but if these wounds open up, the chances of infection would increase. So rubbing of eyes has to be avoided. Generally head bath is to be avoided for a week after the surgery, especially for first 2-3 days after the surgery. Another important thing is the eye surgeon will give you a shield. This shield will help you protect the eye during your sleep, because many a time there is some itching in the eye and you might unknowingly rub the eye in the night. So in order to avoid that, you will be given a shield which you have to place over your eye for the first week or 2, depending on the doctor's instruction. And the most important thing is regular application of the eye drops. Now these eye drops vary from each hospital to hospital, and so the important thing is that you should give a gap in between the eye drops. Like if you have to put 2 drops at a time, then you have to give a gap of at least 5 minutes in between those 2 drops. Secondly, whoever puts the drops, see to it that his hands are well sterilized, and then only you can put the drops in. Try to avoid touching the upper eyelid and whenever you put the drops. So these are the common things which you should observe. Instruction regarding driving and swimming, this have to be taken from your local doctors, because it varies from the type of surgery you have undergone. But specifically avoid swimming for a period of at least for next 2 to 3 weeks, and also hair dye has to be avoided as much as possible, and eye makeups have to be avoided for first 15 days. So all the best for your recovery. Hope you get well soon. Thank you.